Hi, Paul.
Hi, Sarah. How are you?
I'm good. Okay, so it's Paul Goldberg and Sara Willa Ernst on the podcast. It's a rare combo. I don't think we're often just the two of us, but I think it's a special combo this
It
week.
is. It's going to be fun. Yeah.
Yeah, and so I'm filling in for Jacqueline this week, and we talked to her this morning from Big Sur, and she's in California right now. So I think we're kind of seething with jealousy, but selfishly, I get to host the podcast this week. That's
Well,
what
this
that
is
means.
great. It's always great, and it will be great this time as well. I wish we could all be in Big Sur, but then again, tomorrow I'll be in this week later I'll be in New York, and I'll miss next week's event as well.
Yeah. We should host a live podcast recording in Big Sur, right, Paul?
Oh, that could be fun. Where the cancer letter reporters go. And she's still working. She's not on vacation.
She is. Yeah, she's doing both.
It's a working vacation.
Yeah. So she's not totally ghosting us.
Right.
And we know this because she wrote a story in last week's issue from California. And that week's issue was an NCAB issue through and through. We had 3 big stories coming from that meeting in last week's issue. And I guess I could go through the headlines real quick and then we can
please
drill in.
do. Yeah.
Okay. Awesome. So the cover story was about a new cancer vaccine advisory committee, and that's the result of a public-private partnership between NCI and the Foundation for the NIH. So the committee, they're developing a roadmap, and they have a goal to hit a $200 million target to advance therapeutic cancer vaccines. So then we have story 2, which is the story that Paul wrote. And it's about a new working group that will conduct site visits and advise the NCAB and NCI director on cancer center grants. And then we have from our California girl, Jacqueline Cobb. She wrote a story about NCI Director Tony Letai's, his director's report. And yeah, the last story was just a sponsored article on early onset colorectal cancer, which we will be hearing much more about in this Friday's issue. So yeah, I guess we can get started. I mean, in your reporting, Paul, from the NCAB meeting, just what really jumped out to you?
Well, maybe we should even go back a little bit, kind of take a look at it more in perspective of how NCI is covered or what NCI is producing in terms of news. And this is an interesting time to be a journalist, as I may have mentioned. But, there are times when NCI is kind of, as a news story, either so stable that it's dormant or so active that it's like erupting all the time. I mean, there's news outbreaks all the time. And we're, I think, in a place where it's news outbreaks all the time, and weirdly, FDA is kind of getting either dormant or it's kind of really kind of very, very hard to understand, figure out, and maybe even premature to make sense of it. I mean, we try and we do. And actually, if you look at the stories that are most read, there is an FDA story there, but it's kind of personalities driven about Vinay Prasad. But also both of the stories, of the big stories that kind of the more focused stories that we ran are the roadmap and that advisory committee on the site visits. And so,
yeah.
okay.
Why don't we jump into that first story about the $200 million on cancer vaccines?
Yeah.
So in some ways, like $200 million kind of sounds like an endorsement in some ways of cancer vaccines, but we're also in this environment of vaccine skepticism. So do you think at all when it comes to cancer vaccines, therapeutic vaccines, they're kind of, for lack of a better word, immune from that?
That's real good. It's not $200 million, by the way, because there's no $200 million on the table right now. It's a hope. It could be 100 and could be 50 million, but the objective is to show that this is what NCI, together with Foundation for NIH, can do. And here's something I'm looking forward to learning. And we have a Q&A with Dr. Letai set up for early April. What I'd like to ask him is to kind of slowly walk me through kind of a question one, which is, why is it better to have a roadmap as opposed to just let science take its course? What does a roadmap do? And it's an interesting question about how science should be funded now, because the old systems for how science is funded goes back to World War II. When the U.S. government first became interested in funding a lot of science and bioscience and all forms of science. So in a way, it would be interesting to see how he sees it. And it would be interesting to have that kind of drill down into the kind of the bigger issue of how it should happen and why this. And it was very interesting to read that story, to understand it. And yeah, and it's interesting also that Letai is being really very much an activist, cancer NCI director, and he's not doing it in a way that, or at least I haven't seen him doing it in a way that kind of not respectful of the organization that he got. He's very respectful of it, it seems. So that means, he can he can deliver on his goal and promise to bring stability to the place right now.
And those are some of the famous words from Jacqueline's story, the third story about the director's report, which was stability, stability, stability. That one is just kind of steered into my head from reading that article.
Yeah, and that theme kind of begins with my conversation with him before his first NCAB. He just keeps on talking about stability. So, I mean, my sense of it, and it's probably too early and to really say it, is that he had a plan as he came in, and he's working through the bits and pieces of this plan, and he's doing it in a way that does not that makes friends rather than enemies. That's maybe it's wishful thinking, but that's what I'm seeing.
Mm-hmm. Yeah. Maybe we could also dig into the story that you wrote specifically last week about site visits. Do you want to give us a little primer on that?
Well, yeah. Well, site visits are, most center directors would tell you, have been, it's one of those curious institutions and traditions in cancer. It has been there for a very long time. And it's basically what it means is that a bunch of cancer center people show up at every review of the cancer center, either a new center seeking designation or renewal of a designation. And they show up, and it's a big to-do, a big dog and pony show. And it's really high-level productions. And it's actually incredibly useful to matrix cancer centers, because the dean shows up, all these folks show up, donors show up, a House member shows up, a senator shows up perhaps, and it's a big to-do for everyone. It's a huge celebration of a cancer center. But does it really add to the scientific mission of the center? Well, maybe, because really, if once you've reached comprehensive designation, you can't stand still. You have to keep on improving, which means that you have to compete for the resources. So that's why it's really important. Well, with this administration, what happened was all of the pieces of review, all reviews, including the cancer centers. And by the way, there's nothing analogous to the cancer centers program in any of the other NIH institutes, because that's kind of the specialness of cancer, both as a political structure of cancer research and also as a culture. So suddenly it all goes to the center to the sort of the central scientific review done by NIH. Now here you really have, since it's cancer centers, you really have to be open to nuance. And the nuance here is that it went pretty well even without the site visit. And, NIH didn't want to do the site visit. So it went really well last year, from what I hear, mostly because reviewers were just exquisitely qualified. So, but people were still kind of asking for it. And then this idea came about to bring about a site visit, in-person site visit, bring the cancer center directors together for that, to do that, and look at every cancer center each time it comes up for review. And this would not be done based on NIH sort of centralized review of the science. It won't be scored in the same way, but it would be considered by the NCI director, who, by the way, has to sign off on the award, and by the NCAB. So it's an interesting idea. Could be Solomonic, could be not, could be. But yeah, who knows? But it's an interesting way of letting the cancer centers have their review.
Yeah.
Their site visit.
Yeah. Yeah, I remember I spoke to you last week and I read your story, and like the immediate question that I have was, okay, they got rid of the site visits. Now they have a new site visit, but it is more of a, it's not a kind of hard piece of criteria when it comes to decision. It's more something that could maybe potentially influence. It's more input. And, in some ways, is this an appeasement of just the people that really wanted to have the site visit come back? Or, are they potentially kind of humoring the people who missed the site visit? Or, will this actually serve a legitimate function? I think it's kind of hard to answer, but that was like the immediate question I had.
Well, I think the answer is all of the above. People want it, and it's useful. If they want it, it's probably useful just because they want it. It's not a waste of time for most people. Especially, you do want those resources. You do want to know how the place is operating. And why not? If that's what the center directors want, why not give them that?
There was also a lot of conversation in your story about community outreach and engagement. There was one NCAB member, Karen Winkfield, who really harped on it. And, she said some directors really think they understand it, but they don't. So I don't know. What was she kind of getting at?
Well,
there?
It's, community outreach and engagement is an important part of what NCI has to do. You could make an argument that it's even in the National Cancer Act, because of, when it authorizes the 15 cancer centers in 1971 to be built. It doesn't mention community outreach and engagement, but it mentions the kind of the outreach. It mentions it more as a public health role of the cancer centers, to bring out the science into the communities. And that's been there really all along. And an argument has to be made that it's a good thing to have community outreach and engagement. And as a piece of the cancer center director, of the cancer center designation, it became kind of very, very large part of the score. I guess I actually hesitate to tell you when. I can point to the story where it happens, but it's about, it was on Doug Lowy's watch, and it was, I guess, at least 10 years ago, maybe 15, that it became a very big part of how you designate cancer centers, how you score that. That will continue to be scored, by the way, by NIH, within NIH. Cancer center directors, some of them understand population sciences, and some say they understand that, and probably even believe they understand that they don't. So that was the point that was being made, because once you're in that world of the COE, you don't necessarily, it probably, there are as many places that have COE as well. If you've seen one cancer center, you've seen one cancer center. And if you've seen one cancer center's COE program, you've seen one cancer center's COE program. So it's all very complicated. It's not something that, the concern when at the beginning of this administration was that Musk and such, all those people with blunt tools, would not understand what COE is and confuse it with DEI and whatever you think of DEI, and just cut it as and most cancer center directors, or most cancer centers that I am in touch with, most people I know really like COE. It's like a site visit, and most wouldn't know what to do, how to operate without COE. I mean, you have basic scientists wandering out into the COE office to get leads and ideas and make better proposals for this. Now, another thing that I heard from Tony Letai in our first Q&A was that he wants to make it easier for cancer centers to get redesignated, and how that fits into there, I think we have to wait for details on. And you know, these are decisions that are, I don't want to sound partisan, but they're decisions that are political decisions ultimately, and regulatory decisions. It's not something, you know, that came down as the truth. So I don't know who is to say how these things should be weighed, you know? So in a way, it's really up to him. We're all looking forward, all of us, to covering the new NOFO for cancer centers, right? Notice of funding opportunity, and that should be coming out pretty soon in some form. So, looking forward.
There was another point in the story where it was talking about the NCI designation process and how sometimes it would produce kind of thousands of pages, reams of paperwork, and essentially, is anybody really reading all that is produced throughout the designation process? Well,
the argument is no. I mean, that's what the answer seems to be for a lot of this. You know, when in doubt, you write a longer story, you know?
I think we're familiar with that.
Doesn't work here, even though we publish some of the longer stories. And it's, yeah. So people write long, sort of expansive exegesis about this programs that they have. So yeah, I guess I can't really. It's being said that no is the answer is no. A lot of the time, is there harm from it? I don't know. Probably not. Yeah, I mean, everybody has a good shredder.
Yeah, but I guess the idea is that there's kind of value in the process beyond just what is produced from the process. It's funny. Kind of like why, I don't know, this is kind of a silly analogy, but I'm like, we have a Christmas party every year, or like, you know, companies have retreats and, you know, in-person types of experiences where they have a shared mission and goal. And in a lot of ways that kind of brings people together that wouldn't otherwise talk to each other or interact or have the same type of buy-in. I'm guessing that's really where some of the value in the process comes from.
Yeah, having covered cancer centers for a really long time, I think of them as a culture, a highly collaborative culture, and the scientists all speak to each other mostly. It's not It's not the enemy. When they say to you, the enemy is not the excellent cancer center down the street, the enemy is cancer, they mean it. They really do. And this idea of the EABs, people serving on each other's, EABs and advising cancer centers about their grants, advising each other. It's really kind of cool because, these are people who have no secrets from each other in some ways, and it all works really well. If there's a few thousand extra pages per application for redesignation, then I am certainly not worried about it, but I'm not the one reading that track.
Yeah. Yeah, it's not your homework assignment.
No. So it's really kind of the problem to be solved by the Cancer Center's branch and by Tony, who has to read it. So,
well, I think a lot of the elements of this conversation, when we're talking about COE, when we're talking about kind of collaboration with different types of cancer centers, when it comes to maybe external advisory boards or whatever, these are all little hints to maybe a story that we're putting out this week and maybe the subject of next week's podcast. So I'll just give you that little hint right there. Yeah. But is there anything else that you'd like to add about the NCAB meetings, Paul?
Well, it's very interesting that we used a lot of words. Speaking of long-winded presentations, we used a lot of words this week to cover this NCAB, which is great because I think it deserved it. It definitely, as news story, it definitely warranted all the attention we gave it. And it's kind of going back to how we used to how we cover NCI, sometime around really the beginning of Harold Varmus's directorship at NCI. I realized that here's this guy who is sitting there for 45 minutes without notes, holding forth, bringing out this precise, beautiful language of how he is going forward with NCI and what his plans are. And I could kind of see how people within every grantee, every cancer center would sharpen the number 2 pencil, take the printout of whatever we ran and go through it, and see how that affects them or whoever. And this is kind of when NCI is very, very interesting. And that since then we've been doing the director's report, if not verbatim, but close to it. And it's always been very, very interesting. And this is where I can see how it's very important to do that. But then on top of the director's report, there were also these stories which were more important than the director's report, which one of them was this roadmap. And that raises more questions in my mind than it answers, and it answers a lot of questions. It answers all the questions it needed to answer. But my big question is, why is it better to have a roadmap? And then of course there was the other question about what do you do with site visits and how do you review cancer centers? Is cancer center really just another grant? It's not. It's a culture. And we ran that a story too. And the story 3, of course, it was the director's report, which is not verbatim, but close enough. So it was a very interesting package to put together. It was kind of like a big news outbreak for us. And if you look at the readership, it was very interesting to look at what's trending right now.
And all of this reporting builds on itself. So it definitely informs a lot of our questions for maybe a future interview with Letai or just future reporting on NCI.
It's on the books. I'm looking forward to it. So, all right. Well, thank you so much.
Yeah.
This is a wonderful
Thank you for
time.
your reporting.
Well, thank you for your reporting. And this is a great time to be a journalist. It's also a really interesting time to be covering cancer.
Amen.